Welcome to today's program, and thank you for joining us. I am Eishelle Tillery, the Vice President of the National Black Leadership Commission on AIDS, sitting in for C. Virginia Fields, the President and CEO of the National Black Leadership Commission on AIDS, Incorporated. The mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower Black leaders to meet the challenge in fighting HIV, AIDS, and other health disparities in their local communities. Today, we will talk about shifting demographics of the HIV epidemic and the increase of STIs among youth. April 10th was the National Youth HIV/AIDS Awareness Day. According to Centers for Disease Control, young people make up nearly 1/4 of new cases of HIV diagnoses. In the U.S. per year, 81% of those cases were among LGBT youth, with Black and Latino LGBT males making up nearly 80% of those diagnoses. Here today, Dr. Carol McLean-Long, an award-winning medical expert specializing in the field of HIV/AIDS. She is the former HIV medical chief of Renaissance Healthcare Network. Today, she runs her own medical consulting company and currently serves as NBLCA'S medical director. Welcome, Dr. Long, and thank you so much for joining us here today. First, tell us about how you first became involved in the fight against the HIV/AIDS epidemic.
It's kind of like it was indirect at first. In the 1980s, remember I'm only 20 years old, I was working as a phlebotomist as a part-time job. And I remember that I went into a room to draw blood in somebody in isolation. It was a very young man, looking very ill, and I was wondering why I was there. And then in the 1990s, I started to see another version of the epidemic when I was working at one of the city hospitals in the Bronx. And when we were there, we saw a lot of drug use, people coming in very ill. They had all kind of infections that we didn't really know anything about. And it was a challenge for us to work every day because half of the time we did not know what we were treating. And then you saw the other side of society from the private hospitals versus the public hospitals in how they're living in wards, and you see them going through all of these changes. And then you started to hear things about HIV, and people were talking about PCP. And those are the things that impacted you as you start to go along. So that was what made me, in the end, come back to HIV.
Wow, thank you for sharing that with us. Based on what you witnessed at the beginning of your career, as you just told us, do you think that there has been a shift among the perception of HIV?
Very much so. In the 1990s, when they first started to open up about what was HIV, it was quote unquote the gay disease. And people, because it had to do with sexuality, people were really very not nice about the things that they would do and say. In the 90s, you could see the fact that people were not allowed to go to barbershops, people were not allowed to cook for you. Sometimes when they would go home to their families don't want them to interact with the other children in the family. And a lot of things, you know, serving them separately on paper plates while everybody else is using dishes. Those were the kind of things. And then you had problems with people. They automatically assume that you have done something wrong. That's the reason why you ended up with HIV. Not looking at it, it was just a sexually transmitted disease. So that's what you see.
And so why do you think that STD rates among young adults are on the rise in today's times?
Because even though we have treatment and even though we have education, people hear what they want to hear. So the messages are out there. Every time you turn on the TV, there's something about STDs, there's something about treatment, there's something about HIV, but people don't want to hear it. They want to live their lives. There's too many restrictions. So what people want to do is to do what they feel like they should do. And they figure, I'm in a nice circle of friends anyway, and I'm dating only certain people. So why would I get an infection? Because I know the group that I'm interacting with. And the group I interact with, nobody has any STDs, right?
That's true.
Exactly.
Well, nobody's sharing it.
Exactly.
Nobody's telling you that information. Do you often encounter young people of color who think that they're immune to HIV or other STDs? I mean, just by what you just said a little bit in the last question, I would think that you run across many different young people who may be surprised or feel like, how did this happen to me? So
the problem with young people, remember when we were young?
Yes.
We were invincible. We could do anything and no one could tell us anything, and we can overcome everything. So that's what we have with young people. It's not that they don't understand, that they think that they're immune. They're young. These things don't happen to them because they're young. So they're in relationships, but they don't see them as relationships. I'm just dating, I'm just kissing, I'm just touching, I'm not really doing anything. It's not one of those kind of things, so why would I get anything? This person is in class with me. They go to school with me. I hang out with their family. We play basketball together. Nobody is thinking about what is behind the relationships that they're having and the fact that they're becoming more and more sexually active. And because they're not looking at it from that point of view, they think it's okay for them to have sex with this person this week and that person that week because we're all together. Because when you're young, if you start to become sexually active, you usually don't stick to one partner. You have multiple partners. And they don't understand, because you're sharing each other, again, that's something that they don't think that they're doing, but you are sharing each other in a group. You know, and so since you're sharing each other, one person's infection will pass on to the other, and that's how things spread. So those are the things that young people have to get into. Also, they figure sometimes that they're not penetrating. Okay, I'm only touching and I'm only kissing. But the question is, then you transfer from one spot to the other. So it's more than just touching and kissing. Because like a young lady was very surprised when she got pregnant in a swimming pool. I go, why? You were in water. And so therefore the person ejaculated next to the area of your anatomy. It's just swimming upstream. It went upstream. You end up becoming pregnant. But you go, but we didn't do anything. But yes, you did. You were being intimate. And people don't understand, as long as you're intimate, you can transfer different infections.
That's interesting. I've never heard anyone explain it in that way about those challenges that youth may have. But what do you, other than them having relationships with each other and believing that, you know, this is my friend, I grew up with this person, I know their family, and just thinking that they're just doing things that young people do and having fun. What are some of the specific challenges in addressing STDs in youth of color in New York today?
Of today, what I think we're more worried about is the fact is, who are you dating? A lot of the kids are now dating outside of their immediate circle. And they're dating people who are older. See, a lot of the relationship is with a young person and an older person. A person that's, say, 4 or 5 years older is more sexually active than the younger person. And their experiences and the infections that they may have, they're going to bring it to this younger person. This person doesn't understand that that person is more experienced. So therefore, the exposures from that person now become your exposure. And then you're still interacting with your group, and now you're spreading things from one thing to the other. Also, kids are drinking a lot more. You know, they were drinking in the old days, and they're still going to drink. The same percentage of the population is still drinking. But now, a lot of them are drinking more to escape. And if you, every time you turn around, I laugh because I see all the commercials. Anytime you see a group of young people together, there has to be alcohol. Okay, they're smoking marijuana, they may use coke sometimes, but for the most part, they're always doing something where they want to be free, they want to loosen themselves up. And that's one of the things that I worry about, is like, how loose do you want to be? Because with drugs and alcohol and you're under the influence, your inhibitions are loosened to the point where you may end up doing things where normally you would have said no. And that is how I think most of the infections are being transferred from one person to the other.
And in saying that, do you believe, or how accessible do you think that testing is for young people of color in New York? Do you think they need to ask parents' permission for testing, or any other? I mean, do you think they need some kind of informed consent? Should it be something where they inform their parents about, or should it be something like with teen pregnancy, you can go have a pregnancy test, but you don't have to say anything about it to your parents.
Pretty much the law was changed a few years ago where you do not really have to ask your parents' consent. The age of consent for New York City is from age 13 up to age 64. You do not have to go. If you're a doctor and you're talking with your doctor and your doctor realizes that you are sexually active, the doctor can offer it to you and you can accept it. You can also be treated by that doctor for these infections without necessarily informing your parent. We don't like to do that as doctors. We do like to interact the parent, but sometimes you cannot. But then you have to work in the best interest of the child at this time to make sure they are taken care of and try and find, some way to have the interaction with the parent. So those are the law versus, the nuance of a family relationship. You try to work with both. But by law, we can test you from age 13. If you want to be tested under age 13, most of the time we will try to bring a parent in because the child is under 13. And we don't want any interactions in terms of the child thinking that they're adult enough that they can do certain things, even though 13 is not much of an adult kind of thing, but still, because the law is more protective of a 13-year-old than, say, a 12-year-old. That's just nuance.
Do you find that younger people who are positive for a STI and then need treatment and they don't tell their parent, do they complete their treatment? Or
most of the times they will. People think that kids, for the most part, are irresponsible. If they know that they're sexually active, the majority of them will come in and complete their treatment. Because one, they know that they're protected. One, they know that they're going to be taken care of by the staff at the facility, which even though the parents may not want us to because they say you are not the parent, but we are going to work in the child's best interest to make sure they are safe. So they will come and they will take their medicines, majority of them, and complete the test and actually come back for their follow-up test because they know that they have trust in that facility.
That makes a lot of sense. Do you think that peer outreach is important to effectively address prevention? I mean, like not telling your parents about this kind of, I have a STI, which means they consented to sex and they agreed to have sex, something that their parents probably would not want them to do. But I'm just wondering if the message is not coming from your parent, not coming from a medical provider, but coming from your peer and just educating you around prevention measures and treatment and things like that. Would it be easier for the youth to better understand what their risks are?
Yes. Well, we're not talking just your friend. You see, people think when you talk about peer counseling, you're talking about, your best friend that you've been with all the time. This is a youth that has been trained in a medical facility to provide information. That youth is taught what is right, what is wrong, how to protect, how to counsel somebody, and how to refer. And the youth is there to guide them. They're not there to tell them what to do. They're there to guide them and give them the information so they can act upon it. And they're more likely to trust that youth because that youth is their age, have been experiencing some of the things that they're experiencing. So that is the reason why I think it is the best for them. And you have to have different kind of youth. You cannot only have the youth that's a straight A student, which, they got everything right and, they dress a certain way. And no, it's every aspect of it. If a person is gay, they would prefer to talk to a person who is gay. If you're a lesbian, you want to talk to a person who can relate to what it is that you're experiencing. Especially when you're young and you're trying to come out. And that's what people don't understand. You don't understand your sexuality anyway. So no one, if you're not experiencing some of that, you can't tell me what it is that I'm feeling. But a person that's gone through that, or is at least going through it with you, and they have more education, they can help you and guide you and steer you to the person to go and talk to. And that's why I like peer education. It's one of the best things I think that we can do. And we need to do more of it. And the thing is that we do not have peer education going below age 13. And I think we should. Because have you ever seen some of those little 5- and 6-year-olds? Those are some sharp cookies. And they can really tell you about the facts. They may not understand fully everything, but on their level, if you speak to them on their level, they'll be able to say to you, I don't think you should do that. you know, and what are you going to do? Not listen? So I believe in peer education, yes.
You're absolutely right about that. It's funny because I've been in the field for so long, and I have 2 daughters, and talking to them about HIV/AIDS from the time that they were very little girls, and then now, you know, they educate their friends. And I remember people used to tell me all the time, why do you explain that to them? That's too much for them to understand. But now when they were in high school and faced with this information and the false information they would receive about STIs and HIV and other health disparities, they would always say, no, I know this to be a fact, and my mother, and so just being able to educate. So that, I think peers are very important as well. And I would like to see more. My
godchild is like your daughter.
Yeah.
My godchild remembered. She says, I remember when I came to one of your lectures, I was sitting down and I could not have my feet on the floor because I was too small. And you were showing those nasty slides. I saw all those pictures of the penises and the things, and I can't believe that. But yet, when she got into middle school and high school, she became a peer counselor because she had the knowledge, and she has gotten the knowledge over the years. And the more you spread the knowledge, and the knowledge is correct, the better it is for the child, because the child wants information.
They do.
And, you know, people try to hide it. And I think one of the things that we need to do is to tell them what they need to learn at their level. Sometimes we talk above their heads or below their heads, so we're insulting them, but talk to them at their level. What they ask you, that is what you should answer in the correct manner. You know, don't do that other thing where you don't need to know that. Yes, you do, because you asked.
Absolutely. And in saying that, what do you think parents need to know about talking to their kids about STDs and prevention? I know we just mentioned it briefly, but what do parents need to know specifically about prevention?
I'm going to age myself right now, but I'm going to say, parents, remember the blue lights in the basement. Remember the back seat of the car. Remember when you went to the drive-in movies. Seriously? And you're talking about the kids today, you know what you did. Now, just because you are guilty of what you did, you should not impact the children by acting like you were purer than snow, because you were not. Because I remember when I was a child, my mother said she caught me in the bushes when I was 4 years old. The little boy and I were saying, you show me yours, I'll show you mine. This is what you do as you get older. So you need to show so that they understand. And my mother, I remember, pulled me out of the bushes and said, you don't show your little boys anything in the bushes. Okay, mommy. Did I understand what I just did? Absolutely not. But it stuck with me that I should never show a little boy in the bushes. Okay, so these are the kind of things that we talk about when you have to transfer the information.
And I think as parents, being able to have those conversations with your children will be more helpful in terms of what they are faced with in the community, because there's a lot of myths and misinformation as it relates to, number one, HIV and other STIs. What tools can we provide parents to ease the process? I mean, I think sometimes it may make parents remember some of the things that they've done, and so it makes them feel shameful. But what kind of tools can we provide to parents to help them make safer sex practices, prevention with their children, more of an easy kind of conversation? Or
parents have to remember one thing: you're the parent. You decide how much you tell your child. Your child does not have to know every single thing that you have done, but you can relate things according to experience. Don't be uncomfortable or ashamed of the things you have done. You did it. It's past. It's over. I think part of it is because some of the shame of the past is coming into the conversation of today. But don't be. Accept it for what it is, and then discuss the things that your child needs to know. And speak to them from your heart. You know, don't speak to them like, you know, you're talking down to them. Speak to them from your heart. Listen, I know you want to have sex. That's what I told my son. I said, sex is the best thing since sliced bread. But guess what? You're not getting none. You're not old enough at this point to understand what sex is. And for them to understand, sex is not just a slam bam, thank you, ma'am. You got to look at the person after you've had sex with them. You're going to see the person the next day. You're going to have interactions with this person. Do you still want to have interaction with that person after this is all over? How are they going to treat you? Are they going to like you again? Are they going to decide, I don't want to deal with you? Are you the person that's going to have sex with everybody and nobody wants to take you home to mama? So those are the kind of things that you have to say to your children, that sex is not just sex. Sex involves the day after, the minute after, even, 2 days after. And then you also have to tell them some of the negative things that can happen with sex. Sex is not always good. The whole illusion on television that sex is so wonderful, it's not always good. Sometimes there are bad experiences that come with sex. And you have to be able to, integrate that and accept that and see how to make sure that does not happen again. So that's what we want to tell them. Those are the things.
And, one of the things that the National Black Leadership Commission on AIDS has done for the last couple of months is we implemented a youth program. And we reached out to an organization, Young Faces Smiling, that goes into different schools, high schools and middle schools, and talk to children about other things that, like education, careers, and things like that, to help them focus on areas that would be beneficial to them as they get older. They're in school, and a lot of times they're having these sexual conversations, and then their mind shifts to sex and not pay attention to why they're there learning and becoming educated. And one thing I like about Young Faces Smiling is that the one of the founders who leads these workshops, she utilizes celebrities. She utilizes people that young people pay attention to get her messages across. And when she approached us about working with her and introducing health and the importance of safer sex into her curriculum, we thought it would be a great idea.
Very well.
And we begun, I would say, early February, and it goes until the end of June, these workshops throughout the different boroughs. And what's surprising is that in some of the schools that they attend, well, most of the schools they attend, they're not getting health education, which is supposed to be part of the Board of Education's curriculum, to educate children around different health issues, and especially HIV and STIs. And it's funny too, because the parents are definitely a part of the workshops and what the children are learning. But there's a lot of resistance from the parents as well, and not really what is this? What are you teaching them? And instead of being a little bit more open to, okay, maybe you're taking this off my plate, and then I can pick up where you're leading them. And it's been a little resistance in that way. So, in saying that, what's your overall thoughts about what should be done to increase awareness and prevention in STDs among young people? I know in BLCA we started doing the youth initiative, but what are some of the other things we can do in the community to better improve in this area?
You need to talk. And I think that's one of the things that I don't see happening as much. And you have to talk from a truthful level. For instance, I do a lot of work with the churches in my area. I do sex talks. I do drug talks. And my drug talks and sex talks are very graphic. I tell you what it is that's going on. I do not try to make it, all sweet and nice. And the parents have to get over their fear that if their child learns about sex, they will have sex. It's actually the opposite. The more you learn about sex, the less sex you have. And so people don't understand that, because if I ever showed you one of my demonstration of sex, you would never have sex for 10 years. Because, sex is a funny thing, it's not pretty. So you have to tell them the truth about it so that they understand what it's all about. It's not this beautiful thing on television with the beautiful gown and the bubbles and the flowers and things. No, okay, it's rolling all over the bed, the sheets get wet. I mean, those are the things that you have to tell them, because kids have this illusion. And once they understand truth, they usually will make the right choice. You are not going up plane without a parachute. So why would you have a sexual encounter without a condom? And you have to relate things to the things that the children will understand, and they understand that. You also tell them, you need insurance. Your condom is your insurance. And then you give them the rules of the condoms, where to keep the condoms. Do not put a condom in your back pocket of your slightly tight jeans. Your body temperature is too high, so therefore it will make the condom stretch out and break. And a simple thing like that, somebody will remember. And they will carry their condom in their pockets. Mm-hmm. And so therefore they will always have a condom. Because she said, don't put it in there, put it there. And those are the kind of things you do. And make them touch and feel a condom. Mm-hmm. You know, make sure they understand what the tools are. I'm not going to say I'm going to give you a condom, right, but I want you to understand what is out there to protect you. Mm-hmm. And that's what we have to do. And the parents, if they understand, we're not trying to take your role, please.
Right.
I do not want your job. I have my own child, you can keep your child. Mm-hmm. But I will assist your child if I have to.
Absolutely.
Okay. Mm-hmm. When I send off kids to college from my church, this is my church now, every child gets 1,000 condoms. Mm. I send it to them, to their school. And at my son's college, when I went, and it was a state university, I asked the permission. I sent it to the resident. I sent the blowjob condoms as well as the penetrating condoms. And I put it, and when I went to the school to visit, my beautiful jar was there with not too many condoms left though. But at least they understand. And they were told me for that particular semester in that particular dorm, mm-hmm, their STD rate was very, very low. Wow. Because it was there. They didn't have to run and find money to go get it. And it was understood that you were expected to use one. So.
Thank you so much, Dr. Long. I mean, this conversation with you today has been enlightening, and I hope that the viewers today learned something from you as well. You can learn more about NBLCA at our website, NBLCA.org. Also, look for NBLCA on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. Please let your family, friends, and neighbors know about this programming. I am Eishelle Tillery. Thank you for joining us, and hope you'll tune in next time for NBLCA's Health Action TV here on Manhattan Neighborhood Network. Thank you again.